healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. We are so excited about today's episode. We're introducing you to a new guest, Dr. Nayo Wills. And we're going to be talking about a very popular topic. One question we've been getting since we started the show is on hormones. She's been so kind enough. She's going to come on twice. In this first episode, we're going to talk about functional medicine and understanding hormones and hormone therapy for men. Today, we'll talk about what is functional medicine, the differences between functional medicine and conventional medicine. What are hormones? How do they function? Abnormalities and things that we might see with aging. Common diseases, signs and symptoms. What the patient experience is like when you get diagnosed, treatment, and how you're evaluated to see how you're responding to that treatment. And where you should start if you think you might be interested in pursuing this sort of treatment. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative podcast, along with Alicia and Geraldine, who send their love in their absence. We are a health literacy podcast, offering our nursing perspective. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. By watching on YouTube or listening on your favorite podcast app, it's our hope that you'll feel empowered to ask questions, educated on how you can manage your health, and confident to navigate the healthcare system. If you haven't already, we invite you to subscribe either on YouTube or on your favorite podcast app. If you're watching this on YouTube, you can hit the bell, you can hit the subscribe button. By doing that, it lets YouTube know that this information is important, so that when people like you look for information like this and they go on the search box and they put in similar words that you did, it'll make sure that this video shows at the top of those results. As a friendly reminder, this show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you can call 911. If you or someone you know might be having a mental health emergency, you can call 988. Dr. Wills, thank you for coming on and welcome to the Melanin Initiative.
Thanks, Dr. Kimberly, and feel free to call me Dr. Nayo.
Nayo, great. We love it. Okay, Dr. Nayo, before we get into our questions, we want to know a little bit about you and your journey.
So I have an interesting journey. I am a functional medicine doctor. I'm board certified in internal medicine. And my journey really started watching my father, who's a family physician, practice, and really just seeing the healing relationships that he had with his patients that really were, I didn't understand back then, but I now understand was what actually was leading to the healing effect his patients were having. So I went on to medical school and got in it. And once I got to my clinical rotations, I was like, this is not what I thought it was. So then I ended up obviously completing and graduating from medical school, and then did an internal medicine residency just because it's a very good residency to have a good understanding of health and how to manage health from a more conventional allopathic perspective. However, as soon as I finished my program, I started studying and learning different integrative and functional medicine strategies. And so it was a very circuitous path, but it definitely led me to the perfect place for myself and hopefully for my clients.
Oh, we love it. And where are you from and where do you reside now?
So I'm in Columbia, Maryland. I practice in the DMV area. I do a lot of virtual work. It's primarily what I do at this point, working with clients virtually. And yeah, so I get to see folks from all over the country.
Oh, really? Okay, so anyone can be your patient?
Not anyone. There's a certain, I'm licensed in probably 10 or 11 states at this point, but so not everywhere, but some of the bigger states I'm licensed in.
Wonderful. And so we do like to kind of increase health awareness for our audience. So you mentioned a few vocabulary words. I just want to make sure our audience understands what those are. So you mentioned board certified. Can you just explain what that means?
So that just means that all different, not just medical, but nursing, health specialties have a board that they are regulated by. So when everybody finishes their training in their field, they take an exam. And that means if someone says they're board certified, that means that they have been permitted into that board and that they have passed their exams and they're keeping up the different trainings and learnings that they need to be a trusted and qualified provider.
Thank you. And what about allopathic?
So allopathic it just means that it's probably the more recognized track for medicine. So it's conventional medicine in the Western world versus like an osteopathic would be a DO doctor or a naturopathic would be a naturopathic doctor. So anyone who has an MD likely was trained allopathically in the conventional track for medical doctors.
Thank you. And so we often promote primary care here pretty much every episode. We try to teach our audience that there are specialists out here and they're all expecting your primary doctor to keep everything in check. They're kind of like your parents. You might go out and see your teacher and so and so and so and so, but everyone's expecting you to go home and have someone monitoring all of that in one place for you. And so we promote prevention here all the time. And we know that there's a growing trend among the consumers that sometimes they don't think that those of us in healthcare are here for the right reasons and that we just want to take their money. And so we love it. What we love about primary care is it focuses on that prevention. But unfortunately, and patients recognize this, that sometimes there's not enough time to address all their concerns, and that maybe sometimes we're not also getting to the root cause of the problem, or that we're focused on that. And so we have introduced functional medicine to the audience. And so we're really excited to continue that conversation, especially from your lens. So let's jump right into it. What is functional medicine? What do you tell your patients?
So, functional medicine is when we're taking a more holistic view of the whole person, and so holistic just means looking at the whole being. And in particular, functional medicine is an aspect of integrative medicine that is looking at six core systems that are necessary for a well body, a well individual. So that's essentially what functional medicine is. It's looking at how those six core systems integrate and work together in order to be able to either support wellness or the lack thereof.
Perfect. And what are those 6 core areas?
So there is the hormone kind of system, energy, cardiometabolic, which means heart and like blood sugar and other type of metabolic markers or regulation of metabolic systems. There's the immune system that we're looking at, supporting the detoxification system. And what did I leave out? It'll come to me in a second. Energy, cardiometabolic. It'll come back to me, but there are 6 core areas that we're looking at.
It sounds really similar because when we had Dr. Lete de Jesus, another Dr. Partners practitioner, she had presented, like, I think it was 6 areas in functional, in lifestyle medicine. I don't know if those are similar or not.
They are. Sometimes if people aren't going through a functional medicine institution for their training, they might go through more of a lifestyle track. Then they'll refer to it as lifestyle medicine.
Okay, cool. So what's the difference between functional and conventional medicine?
So functional medicine, as I said, it's a more holistic 360 view of the individual. Conventional medicine is really looking at systems separately. So the brain is separate from the heart, which is separate from the digestive tract, which is separate from the hormone system. So that's why you have all these separate specialists, and they don't really see how all of those are interconnected and how the sum total and how they're working together is the only thing that's going to help for the individual to be well. So it's more looking at a more body organ-based system of care, and also more problem-based. So looking for a problem, and it's more algorithmic. I'm not even sure that's a word, but basically looking at how to treat people in a very methodical way rather than thinking broadly and how can I support the whole system, not just the heart. So that's largely the difference. And then I would say probably also there's less of a spirit mind aspect in the body with the allopathic or conventional medicine approach, whereas a lot more of the functional medicine doctors are going to support a spirit mind body approach. Not all of them, but pretty much everyone's going to do mind body, and a lot of us will do spirit mind body.
Wonderful. And then what about the patient experience compared to that, conventional medicine visit compared to when they might come see a specialist like you?
So, I mean, that you're seeing just and having someone on board, is important if that's something that is relevant for you. So, generally speaking, there are some needs for urgent care, emergency care, things of that sort. If you have a lot of medical problems, then you may want to have someone else on board that is conventional to help, guide you through the more conventional system. Um, so they're still very important for those individuals who need that type of care.
Yeah, so I did a rotation when I was in NP school, and at first I was kind of like, oh, I wish I had done more conventional medicine because that's what my board's exams was going to be
Mhm.
on. But in the years that have since passed, I've been so grateful for that learning opportunity because, like I said, it's growing in popularity, and I have such a great appreciation for it because I'm that patient. I'm that patient that
Yeah.
wants to go through all those questions and find out the cause and maybe try all these other options before I do a prescription. Um,
Mhm.
and so what I notice is, like, for one, typically you get a longer visit,
Mhm.
and yeah, you're going to ask me about my sleep and my stress and my diet and like really want to hear what I have to say.
Mhm.
Um, and I feel like the patients who came through there, they had already tried everything and they were really frustrated and they just were willing to try something different. And that even if it they have to pay out of pocket, they were okay with that because they had tried everything and they could see exactly where their money was going.
Yeah, I definitely agree. That's often the common person who I see. They have been had something that just wasn't addressed, or they were frustrated by not being able to get the answers or the resolution for their health that they were wanting. So, absolutely, that is a big reason that folks will come see a functional medicine provider.
So let's talk about how you address hormone and hormone imbalances. What are hormones?
Absolutely. So, the way that I like to think of a hormone is that it's basically like a messenger. So, it's a chemical messenger that your body uses to help tell any given part of your system how to when to do its function and how much of a downstream hormone is needed. So let me give an example. But the bottom line is it's a chemical message to another part of the body telling that part of the body what to do. So that's just saying it in a very simplified way. So think about for a man, think about the testes. And so there's a part in the brain called the pituitary, which will tell the testes to make more testosterone when appropriate. And so there's a chemical messenger that in the form of what's called a hormone that then talks to the testes and tells it to make another hormone. And then that hormone, largely for men, is testosterone, then tells different aspects of the body what to do. So we'll get into what testosterone does throughout the system. But basically, they're chemical messengers that are outside of that particular part of the body that then tell this part of the body what to do.
Perfect. And so for men in particular, let's talk about testosterone and how it functions normally, and then what we see when sometimes that function is not working as it should.
Yeah, it's really interesting for my men. Usually I don't see them until it's not working. And so that is probably, and for most men, I'll see some men more and more as people are living more stressed lives. Sometimes I'll see men in their 20s, but largely men start to come to see me for hormonal issues in their 40s to 50s. And that's when the testosterone has already started to drop off.
Mm.
So when testosterone is working appropriately, It is, like I said, a chemical signal or message that will tell, for instance, your brain. It helps to support the brain in terms of cognitive function, so just brain function, thinking. It also supports the brain from feeling more clear, so having clearer thinking. It also will message to your bones to have stronger, more resilient bones, and the bone that you make, that it's healthier bone. It also supports stimulating the growth and maintenance of muscle. And muscle is huge when we're getting older because every year we start to lose more and more muscle. And that's a really large gland that's very important as we get older. So testosterone will signal your muscles to keep growing. Testosterone also is really important, especially for men, for heart health. So that's something that's come out in the last several years that is very important from that standpoint. Obviously, the things that people commonly think about, like libido and erectile function, are also relevant. But there are a whole symphony of actions that testosterone supports. So think about the brain, the heart, the bones, the muscles. Sleep is another big one. So that is probably one of the more common reasons that men will see me before low libido or erectile dysfunction. So that's a common one. Also, post workout recovery issues. So my men will be working out and then they start to feel like they're more sore after they work out, or they're experiencing more injuries with their workouts, or joint pain post workout. So those are some of the top reasons, or ways to kind of be aware that your testosterone may be starting to head down and into andropause. And so andropause is just a fancy word for the decline of testosterone in men.
Oh, is that a natural, is that referring to the natural part of aging as well?
So it's a natural trend in men. The more that we work on stress, and this is men and women together, then the more you preserve the function of these different glands making these hormones. So, as I said, I'm seeing sometimes 20-year-olds coming in, and that's because they've had more stress, either psychological or different physiologic stressors, body stressors, that have caused that individual not to be able to make optimal testosterone.
That's really interesting. And so what is their complaint in their 20s?
They're usually really anxious. They oftentimes can't put on weight, especially muscle mass, sleep issues. But probably the biggest one I'd say in the young men, they probably would be anxiety and sleep, libido as well.
And they know they're feeling anxious, or that's your assessment?
Mhm. So they oftentimes, those are the reasons they're coming in. They don't necessarily know their testosterone's low,
But
but
the
that is.
anxiety, they feel anxious?
Mhm.
Oh, okay.
So I didn't mention that one. Testosterone also is a major player in mental health, so anxiety, depression as well.
Hmm, okay. And then what can we expect with aging? What's kind of, I guess, the normal anticipation of that?
Yeah. So I like to speak of something called just getting on in years, and then what I call pathologic aging, which means it's aging in a way that is more compatible with sickness or breakdown. So as
Mm.
we get on in years, then obviously there's going to be a slow decline in the hormone levels. However, what I'm seeing more and more is more of a pathologic trend. So people are burning through their hormones at an earlier and earlier age. And so that tends to, as I said, it's starting earlier and earlier. They're actually doing studies tracking this. And as I said, sometimes we're seeing it in men's 20s, but generally I hear about it most in the 40s and 50s. So it presents with any or all of those symptoms that I just mentioned to you.
Okay. And those are the most common ones in every kind of race too?
I don't see a big difference in terms of symptomatology, so how someone feels with low testosterone levels. I don't see a lot of racial disparity, and I have a broad patient base to really be able to see a trend like that. It's generally they're pretty common, and the biggest one I didn't even mention, fatigue. That may be the biggest one that men complain of, that they just don't have the energy that they used to 10, 15 years ago.
And this is okay. So are you talking about those like 40 and up, or talking about the fatigue?
Anybody. So low testosterone, and we'll get into women in another podcast, but testosterone is and what we call an anabolic steroid. So it's a building hormone, and it supports energy as well. So anybody who has a low testosterone level, that can be one of many reasons that their energy is low.
Okay, so let's talk about the patient experience from diagnosis to treatment and kind of the long-term plan.
Yeah, so the process generally is, if you can, and obviously anyone listening to your podcast is going to be aware of the signs and symptoms of low testosterone, so kind of have an idea of how you're shaking up with those signs and symptoms. The next step is going to be to find a really trusted functional or integrative medicine provider who really understands hormones. You don't want to just go to anyone who does hormones, because you want someone really looking holistically at your health. And then once they do their assessment, generally that's going to be anywhere from 60 to 90 minutes with a functional medicine doctor, where we just are really getting to know you and understand what makes you you. And so once we do that, we'll then order an appropriate panel, which has a lot of biomarkers or lab tests. But some of those are going to include a total and a free testosterone level. So that lets us know where your levels are. And then generally we'll also, from a hormonal perspective, in men get an estradiol, which is a type of estrogen. And so all men's estrogen comes from testosterone. It's converted from testosterone to estrogen in the body. So estrogen is very heart protective, which is why it's important to have appropriate and optimal levels of testosterone, because as your testosterone declines, your estrogen is naturally going to decline, and that impacts cardiovascular health. So those are some of the core hormone markers we'll get, but it's a broad panel that almost any functional medicine provider is going to order, so that they have a more holistic understanding of what's going on. You don't want someone just cherry picking and just giving you hormones.
Mm. Do patients ever say, that looks like a lot of blood, doc?
It does. It does. Most of them, most of the clients who see me super motivated, so they just drink plenty of water and just kind of know quarterly that they're gonna go in for a large blood draw, and they love the information. You know what I mean? It's lovely to be able to really understand what your body's telling you. Because the first thing, I like to listen to clients, but I also like for us both to listen to what your body is telling us. So even if you didn't decide to go on and do hormones, to have a really good understanding of what's going on in your system is very informative.
Wonderful. And so how long did it take for those blood results to come back?
Generally, I tell clients 2 weeks, just to make sure everything is back. Some of them come back a lot quicker, but some may take a little bit longer. So I generally say about 2 weeks.
Okay. And then there's a follow-up visit.
So then there's a follow-up visit. Tends to be somewhere around 45 to 60 minutes, so that we can really go through each of those labs, explain what they mean, and specifically tailor it to you. What do they mean to you, in terms of what have you told me in terms of why you're coming in, and how does this particular lab explain or help to explain that? And then from there, we'll go in and together we'll understand what the options are. I tend to go through all the risk and benefits, side effects with my clients, so that they're thoroughly informed of, the different possibilities. And then they make a decision as to what he wants to do. And then I would write a prescription. And then we would have a follow-up visit anywhere from 4 to 6 weeks later, once their labs are back. So 4 to 6 weeks later, they get their labs, then I see them back. And then that's when we assess, how are you feeling? What's improved? What hasn't?
And that's after you started treatment?
After we started treatment, 4 weeks later, you get your labs, and then come back and see me once the labs are back.
Okay. And so since you're virtual mostly, or telehealth, are you
Mhm.
sending it just to a local lab?
Yeah, I try to use the local labs as much as possible, so they go through the client's insurance.
Oh, perfect. Do you accept insurance?
I don't, and you'll find that most functional medicine doctors don't. I did try, when I first started. It's too challenging to really be able to spend all the time that I want to with clients, and still be able to do what I want to do. So um, some of us try, but usually most of us end up having to go more to a cash based or self pay model.
Yeah, and I found, like I mentioned, that patients actually end up not, they're actually okay with that because they see where their money is going. Because sometimes we pay month after month, we don't go to the doctor, right? And when we finally do go, at least my dad tells me all the time,
Mhm.
I spent 30 minutes in the waiting room. I spent 30 minutes in the room, and I only spent 5 minutes with the doctor. And
True.
so he's wondering, where did his money go? And so I find that patients are okay with coming out of pocket because you've just explained how much time you're spending, where that time is going, and your focus was solely on the patient's understanding and you supporting them in their decision making.
Absolutely, and you make a great point. I I don't think it's specific to me, but generally you don't have to wait in a doctor's office like that when you're seeing a functional medicine doctor because it's more patient centered. So I understand that someone sitting out for half an hour or more waiting, that is aggravating the problem that they're
Oh,
coming, to see. So most functional medicine providers are very aware of that and really try to set their schedule with time so that they're not running 30, 60 minutes over.
great point. Pointing out these differences so that people have a really good understanding of what they're getting. So you mentioned risk and benefits. Let's talk about the different options for hormone replacement therapy.
So for men, I'll go over all of them and I'll tell you my experience, what works the best. So probably the most commonly recognized one is going to be to do testosterone injections, which is when the patient self-injects into a large muscle, usually the thigh, twice a week. And that's what we find gets the more what we call steady state, so more even levels that the body likes versus historically back in the day, they used to do it once a month or even once a week, and it led to more peaks and valleys, which doesn't feel good in the body. So most functional medicine doctors, if they do injections, will have the client inject twice a week, and then so that's one of the ones that I find gets the best levels, and it's the least invasive of the ones that work. The next one are testosterone pellets. And I've done these with clients, and so there's no issue with them. Some clients just don't want to have a procedure every 5 to 6 months. So my slant is for pellets if somebody's willing to inject. So those are probably the two main ways. And then the third one, just to kind of put it out there, is topical. So to use a cream, we find this stuff it just doesn't work that well for men because to get the amount of testosterone absorbed that needs to be absorbed is very difficult, for a man to get that much cream to absorb with that dosing that we need to get their levels up appropriately. So the two big ones are injections and pellets. I've done both. I like injections, but I've done pellets in many of my clients.
For those pellets, where are they injected?
It's the lateral aspect of the glute is where I did them for years. So that's the way that I do them.
And they get replaced every
Yes,
follow-up?
so every other time. So every 5 to 6 months. Generally, the older, less active you are, then it's every 6 months. Um, if you're more active, then it's more like 5 months because you're going to need more testosterone for your level of activity.
Based on their kind of level of metabolism? Is that what it's associated with?
Well, activity, because you're gonna use your muscles more and your whole metabolic system more, so you're gonna be going to the gym, you're walking more, so you just are gonna utilize more testosterone the more active you are, and likely the younger you are.
And that's just an in-office procedure?
In and out, takes, like, 25 minutes.
And, they wanna know, are they gonna get numb? Is it gonna hurt?
With that procedure, at least when I do it, I'm really careful to numb folks really well so that they don't have you feel the prick, so I'm not gonna tell you don't feel anything, but once you're numb, you should not be feeling anything.
And is it the same number of pellets for each patient?
No, all the dosing has to be tailored based to what the person is telling that doctor and, their level of activity, their actual level. There are a lot of factors that go into individualizing that dose, both injections and pellets.
And then for the self-injection, are you getting any pushback, or how do you help men get over that idea?
The younger men will do it without any problem, and even older men will do it. Um, the only people I really have an issue with are people with needle phobia, which is not a large percentage, but there are
Mhm.
folks that just don't like needles, and so those people I would definitely suggest doing pellets. But you need to find a good provider who does pellets. Not everybody does pellets well, and then you need a good provider who can manage hormones and your whole system well. So there are a lot of doctors out there that are just doing hormones and they're not looking at the impact they're having on the other systems. So your ability to detoxify. So the more hormone that you put on board, that all has to be cleared through your liver. So if you're not supporting detoxification and you're not looking at how that hormone is affecting other aspects of health, it can create more problems, but that doctor wouldn't necessarily know it if they're not trained in that. So you just want to really know who you're seeing and what their specialty is, and not someone who just puts pellets in or is just focused on hormones.
What are a couple example of questions patients could ask to find out?
So I would say I would personally look for a certified functional medicine doctor would be one thing that I would say. I would look for somebody who has been doing them for a while. Um, those are probably the two biggest things because if they're a certified functional medicine doctor, they've done extensive training to really be able to understand all these aspects of health. And then if you can kind of have any insight, like if you get a referral to someone, that's a great way. Most of my clients these days are coming through referral or just, word of mouth on in the community. So if you can kind of get a referral for someone who knows how that doctor practices, that's another great way to go.
Okay, as we close out, who's a good candidate for this?
So good question. There's no one that I would say is let me say that differently. There's no particular demographic who is not a good candidate. The reasons that we would think about pausing and or not doing them at all is if a patient has an active cancer,
Mhm.
a history of prostate cancer, depending on what type of what stage and what's going on with their health at that point. They would need clearance by urologist. So anyone with active cancer, history of prostate cancer, unstable cardiovascular disease. We do it in folks who have heart disease, but it has to be stable because you just don't want to be doing a procedure on someone, especially um, just any procedure on someone who has unstable heart disease. So those are the big groups that I would say that would make me either pause or say you're not the best candidate.
Are there any age restrictions?
No.
Oh, okay. So I guess how young would you feel comfortable starting?
I mean, everybody's different, but I leave adolescents for sure alone, and hormonally. And even young 20-year-olds, probably up through mid 20s, I would not do any hormone therapy. I think that they're still developing, and you don't really know how that hormone is telling their brain to stop making hormone, which may have implications down the road. So I tend to pretty much start hormone therapy once someone's in their 30s and up. There's no restriction on age. Now, one thing that I would say that I don't typically see is somebody's severely ill, like they've got major kidney issues, liver issues. Those are clients that I actually don't even typically have coming to see me. But if there's like some severe chronic medical issue going on that's not stable or controlled, we would want the specialist involved to kind of weigh in on that. Um, so I want to just put that out there too.
Thank you. Any special considerations when taking care of transgender men?
I don't do that. I really think that if you're going to do that, you really need to have some extensive training, and I don't have that appropriate training. So I leave it to the experts in that field.
Oh, good. That's actually a good point that you bring that out. That's another question that the patient should ask.
Yeah, I would specifically, if that's something that you're wanting support with, look for someone who has training in that because that's a very intricate
Mm.
um, um, balance that you need to hit. And you really want someone who really understands that very well.
Thank you for mentioning that. What are 3 takeaways for the audience today?
So I would say first, the clients that I really find get the most out of their interaction and partnership with me are first clients that have their own spiritual center and connection, because I find people get well a lot faster and stay well a lot easier if they've got that connection. Doesn't matter what it is, it just needs to be important to them. I'd say the second thing that's really important is to know yourself first. So kind of utilize information that you hear from trusted medical providers and weigh it in. Like, don't just take what I say as, it's the absolute truth. See how that resonates with you. And even in a visit, when you're with someone, just because someone says something, see how does that resonate with you, because your internal doctor is always going to be the best one. And a good doctor is going to want to know what that internal doctor is saying, because I will, work with that because I trust folks' intuition. So developing your intuition and trusting that, and really just partnering with your doctor. Don't look to him or her to be the end all be all. We're not. We really need to partner with you to understand how can I best support you, because you're ultimately the one in the driver's seat.
Well, Dr. Nayo, I know the topic was on hormones and hormones for men, but really what I think you displayed here was what it's like to be seen by a functional medicine specialist. Even the way you just answered these 3 takeaways, it was the whole picture. And you started with know thyself. We don't hear that normally.
Yeah, it's so important. I can't help anybody who, I won't say I won't try, but it's really difficult to help somebody who just wants to focus on the physical and doesn't want to do the internal work. And I know it's not the easiest thing, but it's the thing that's going to get you to where you want to be.
Beautifully said. Thank you, everyone. Make sure you come back and watch our next episode with Dr. Nayo, where we focus on women. Remember, you can email us your questions or show ideas to tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel and follow us on every social media platform. Leave a few comments when you get there. It really helps you support the show, and it helps us get more attention and get the message out there to those who need it, which is why we're here to begin with. You'll find all of our social media links, as well as how to connect with Dr. Nayo, down in the description box. And right now we release shows every week on Sundays at noon Eastern on YouTube and all your favorite podcast apps. We thank you so much for watching. We thank you, Dr. Nayo. We look forward to seeing you back again.
Thank you. Bye.
Thank you for watching. We'll see you next time.